You're listening to Puma Podcast.
How do you prioritize? How do you make decisions? That's a difficult conversation. And I think probably what was lacking globally is to have the right governance system where countries were invited to shape the response, to be part of the conversation on how am I going to deal with these inequities. And I think this didn't really happen. There was a norm that was set, shared with everyone.
The COVID 19 pandemic tested healthcare systems all around the world, and the Philippines was no exception. We faced a multitude of issues during the crisis, which only exposed weaknesses and shortcomings in our healthcare infrastructure that had been there for years. I'm Franco Luna Puma Podcast, and you're listening to Teka Teka News. In this episode, let's look at the lessons we've learned, or didn't learn, from the coronavirus pandemic here in the Philippines.
This accord is a generational opportunity that we must seize. We are the generation that lived through the COVID-19 pandemic. So we must be the generation that learns the lessons it taught us and makes the changes to keep future generations safer.
You just heard World Health Organization Director General Tedros Ghebreyesus. He was talking about the WHO's Pandemic Accord, a new treaty that would strengthen global cooperation and coordination in preventing, preparing for, and responding to pandemics. One of the key goals of the Pandemic Accord is to address inequities in access to medical resources during pandemics. The document also aims to strengthen global surveillance and early warning systems to allow countries to detect and respond to pandemics more effectively. More than anything, the point is to ensure that all countries, regardless of income level, have access to the resources and support they need to protect their people. Here's Dr. Francisco Perez Cañado, who is representing the European Union before the World Health Summit.
What kind of ideas have we put on the table? The first pillar of equity is not equity in handling disease, but equity in preventing disease. So we have suggested very strong provisions on prevention, on outbreak surveillance, on rapid control of outbreaks, all with a One Health approach and with strong AMR provisions.
AMR is antimicrobial resistance.
Because, please, we cannot leave gaps. We have an opportunity right now, which is generational. We cannot leave gaps for pathogens to get through. We have suggested also very strong availability and affordability measures so that we can have, through reserving volumes of countermeasures, plus setting price caps for low-income economies and tiered pricing for middle-income economies, that we can ensure that those which are not producing will have access.
On paper, it sounds like a no-brainer for the international community to sign an agreement outlining the duties and procedures for nations that are experiencing a pandemic. After all, experts agree that the next pandemic is inevitable. So what can we do? First, we need to look back at how we did at the height of the pandemic. Because even before COVID-19 hit, the country was grappling with overcrowded hospitals, insufficient healthcare resources, and an inadequate number of healthcare professionals. And the pandemic only exposed these shortcomings in a brutal way. Hospitals were overwhelmed, and patients struggled to access life-saving care.
There were shortages absolutely everywhere of masks, medical tools, oxygens, PPEs, and countries could not buy them. And the big challenge was that wealthy countries had the power to pay and managed to basically access in priority.
That's Natalie Ernu in an earlier interview on the Puma Podcast show, A Better Normal. She's Deputy Head of Policy and Advocacy at Doctors Without Borders.
The response was that, yes, they had, this concern, but at the same time, without really saying it, they were admitting that they had to take care of national concern and national pressure. And this is why also they, in the end, have behaved the way they have behaved, which was to basically hoard most of the products when they were on the market to serve their own population rather than ensuring a more equitable access to these products, for the countries who were in need of them.
Over the past few years of COVID-19, the lack of hospital beds, ventilators, and other critical equipment became clear. Many hospitals had to resort to makeshift facilities, and healthcare workers were pushed to their limits, often working in unsafe conditions. Another issue that came to the forefront during the pandemic was the healthcare system's unequal distribution of resources. Larger cities like Manila had better access to healthcare facilities and services, while rural areas struggled to cope with the outbreak. Closer to home, we also saw problems with vaccine rollout. While we faced challenges in securing a consistent supply of vaccines, the pace of inoculation also varied across regions. But perhaps the biggest challenge here at home was manpower. For years, nurses and doctors were overworked, leading to burnout and exhaustion. Many healthcare workers left the country in search of better opportunities, exacerbating the crisis. We're pausing for a quick break now. When we return, we ask a nurse what they think of the pandemic accord.
It's not a mandate. It's not like the government has to fulfill it, diba? It's like parang gentleman's agreement lang yun eh. It's just a covenant.
You just heard Eleanor Nolasco. She's president of Filipino Nurses United, one of the groups at the forefront of calls for better working conditions for nurses here.
Sa tingin namin, regardless of this accord, meron talagang mandato yung government to strengthen our health system, which it has not done even before the pandemic occurred, during the pandemic, and even before now. So, may chronic talagang crisis sa ating health delivery system.
We reached out to her kasi sino ba ang mag-i-implement nitong pandemic accord pag na-approve? Hindi ba mga healthcare frontliners natin? I asked Nurse Eleanor to walk me through what the day in the life of a Filipino nurse looks like.
Ang isang typical day, hospital setting, no? They report for duty sa hospital, tapos magte-turn over sila yung parang endorsement. So, halimbawa ikaw, sa isang ward, you will have to check all the patients, give their medication, follow doctor's orders, check on the mga nursing aides mo, kasi meron kang mga gagawin pa other than yung hygiene. Paminsan nga, sila na mismo daw ang gumagawa nun kasi wala na rin silang nursing aid, lalo na pag nagpunta ka sa isang public government hospital.
Eleanor says she isn't convinced the pandemic accord can actually change anything. And that's because the only difference between now and then is the number of COVID-19 cases. Which means even if it is adopted, the pandemic accord is little more than a piece of paper for nurses and healthcare workers.
For instance, sa nurses, di ba, ang panawagan namin nakabubuhay na sahod, pero hanggang ngayon nakapako pa rin yung sahod ng mga lalong-lalo na yung mga nasa private sector sa minimum wage. Tapos yung mga benepisyo, hindi pa rin ibinibigay. Yung COVID benefit nga, ang laki pa rin ng utang ng gobyerno. Low wages, understaffing, yung issue of contractualization na kunwari merong kakulangan sa nursing staff, instead of hiring them on a regular basis, ginagawa silang mga job orders or contractual. Pag contractual ka, wala ka namang benepisyo. You can be dismissed outright. Tapos yung dahilan sa kakulangan ng staff nurses, hindi na nasusunod yung standard na sineset ng DOH na 1 nurse is to 12. Many cases, 1 is to 20, 1 is to 40.
And the government's response? Hiring board flunkers. Here's how Health Secretary Ted Herbosa justified it.
We can call them nurse trainee. It can be a training program as well until they get their certification. So they'll be under supervision of a licensed nurse.
According to him, the idea was backed by both the Department of Labor and Employment and the Professional Regulation Commission. Saka di rin naman daw lahat ng flunkers. The passing score is 75%, pero sabi ni Herbosa, Kung nasa 70 to 74 ang score, pwede na magtrabaho sa mga state-run hospitals. Late last year, the DOH said the Philippines lacks about 194,000 health personnel, as it reiterated the need to upgrade the salaries of workers in the sector.
Bakit pupunta ka sa isang circuitous na paraan para i-fill in mo yung gap? Nandito ang mga nurses mo na pwede, willing, for as long as you give them the right incentive naman. So we're thinking, in a way, they're actually pushing our nurses out. So may exodus talaga ang mga nurses to other countries. Tapos may aggressive pang recruitment dahilan nga sa aging population naman ang mga European, mga first world. So our nurses are leaving the country in numbers, in droves. Kasi nga wala namang incentive na nakikita dito sa ating bansa.
Even now, over 100,000 nurses in the private sector earn just 537 pesos per day in Metro Manila and much lower in areas outside Manila. And nurses in government suffer from work and patient overload even if they do have somewhat higher pay.
Kulang talaga yung oras nila, yung 8 hours. Kasi yung 8 hours na yun, dun pa lang sa pag-fulfill nung mga interventions, punong-puno na yung oras ng nurse. Dahilan nga sa madami yung kanyang pasyente. Ang ideal na kasi ngayon, 1:8 ang acceptable sa international standard na pwede ka pang magbigay ng quality care. Pero sa Pilipinas, 1:12 pa rin. Hindi pa rin nababago sa DOH.
And when our nurses suffer, our patients do too.
Probinsya naman sa mga public hospitals o ilang private hospitals or public hospitals, kulang-kulang naman ang supplies nila. So kahit na PhilHealth member ka, kung wala naman silang mga sophisticated or even basic equipment, you are advised or you are told to go to other hospitals. Kasi walang capacity yung mga public hospitals, hindi pa rin matutugunan yung mga health needs ng mga community folks. So what happens is, yung kung serious na sila, pupunta na sila sa Manila o sa mga tertiary hospitals kasi wala silang ma-avail na tertiary service sa kanilang mga respective provinces.
The treaty is still in the early stages of development, but it has the potential to make a significant impact on how the Philippines and other countries around the world respond to future pandemics. But for Filipino nurses, the problem starts at home, and they say it will take a lot more than signing an international agreement to figure our problems out. Here's FNU President Eleanor Nolasco again.
With or without this accord, immediate is to strengthen the health system. Kasi even nung nagpandemya, dahil sa undercapacitated tong health system natin, ang daming nag-surge at saka nag-re-emerge na mga health conditions that were thought to have been eliminated. Hindi alam ng DOH halimbawa kung ano ang mga pangangailangan on the ground. Kaya yung mga essential drugs hindi nabibigyan adequately yung mga hospitals and other health, yung mga stations, saka mga centers. Pero yung mga non-essential na they're just kept in the bodega or in the warehouses until they expire or near expired.
And that was today's episode of Teka Teka News. Again, I'm Franco Luna. This episode was edited by Freddy Blanco. Our Teka Teka News executive producer is Jill Caro, and our senior editor is Veronica Uy. If you found this episode useful, share it with a friend. Help Teka Teka News reach more people and keep the show going. Thanks for listening.